So, hi all, this is Archana, yeah, certified medical nutritionist. So, hello all, how are you all doing? Hope you are maintaining your healthy lifestyle. Nowadays, I'm getting so many inquiries that too, especially pregnants asking their nutrition requirements and concerns. Yes, pregnancy is a very precious place and also time where it has to be focused on diet, nutrition, and holistic living so that they can enjoy that period preciously and give rise to a healthy baby, and also they can avoid so many risks of abortions or even the risks for after being a kid also. So today let's discuss about nutrition in pregnancy. Yes, so usually pregnancy is divided into trimesters. Like each first 3 months will be called as a trimester. Each 3 months of the gap we call it as a trimester. 3 months together we call it as trimester. So let's see trimester wise how we can eat and maintain our healthy regimen. So the first trimester we call it as uh, something like a 0 to 12 weeks. And yes, of course, nutrition plays a very major role for fetal development, mother health, and labor preparation. So in the first trimester, usually the fetal development, the baby development will start. Whatever after an egg and the sperm is meeting, a zygote or embryo is formed. There actually the development into different organs and also different parts of the body of baby will be started in the first 3 months of the pregnancy. And even mother will have so much of vomiting sensation and nauseatic feelings, bloating and everything. So even to keep all these considerations into mind, we have to design our diet and nutrition. So vital organs develop here, and nutrients help in preventing the birth defects. Whatever the baby is born with blind eyes or deafness, or one leg is not there, or any kind of asymmetry or brain malfunctioning or malformation, all these things will happen if mother is not taking proper nutrition in pregnancy. Yes, so now let's see what are the major nutrients you need to focus in your first trimester. First is folic acid. Minimum 400 to 600 micrograms per day is very essential, because whatever the brain and the neural tube will be formed in this first trimester. So this folic acid is very must. Even once they are preparing for the conceiving also, most of them will be having this folic acid. So continue having this folic acid. And next is vitamin B6 or pyridoxine, which will prevent this nausea. So usually hydroxyl succinate or any of the medicine or tablet or supplement your recommended healthcare provider will be supplied with. So you can ask for that. So having B6 rich foods is also very important, especially green leafy vegetables, nuts, seeds. These plays a very major role in decreasing this vomiting sensation. And protein requirement is very important. This actually it will be neglected by most of the women, because in happiness and also in so much of relatives friends comings to home, they'll be giving you sweets, and they will be eating so much of sweets or carbohydrates, and somewhere they ignore this protein. Without taking protein, how can a baby grow in your body? So, in the first trimester, if they are in ideal weight, they need minimum 50 to 60 grams. If they are overweight or obese, their protein requirement may increase. Once you are giving this protein in any form, maybe paneer, mushrooms, or eggs, or non-veg eating foods, or any kind of nuts, seeds, you can go along with. And iron, yes, 27 milligrams of iron is very essential, so it prevents anemia. Usually, women should maintain 12 to 14 hemoglobin levels. If they are something less than 12, we call it as anemic. Usually, pregnant women will land in anemic because that blood will be flown more to the baby, so that mother body will be deficient of hemoglobin. So, we have to give normal or required amount of iron for hemoglobin formation. Heme is nothing but iron, right? So, globin is the protein part. So totally we'll get this hemoglobin formation with good amount of iron and also protein, so that mother will not land in anemic. So they'll not get any kind of weakness or lethargy, and they can do their routine normally. And to avoid this nauseatic sensation or vomiting sensation, we need to add good amount of ginger so that the digestion will happen in a normal way, or any herbal teas like peppermint, tulsi, rose, any kind of tea that will reduce the stress levels in mother's mind. So this will manage the nausea. So these are the important nutrients or the vitamins you need to focus in the first trimester. So, usually our plate should contain in a balanced ratio of uh, carbohydrates or low carbohydrates, I could say, and protein minimum 50 to 60 grams, and fat, good fat, and also vitamins and minerals like iron or folic acid, B6. For complete nourishment, you can eat all this in the three times a day. So, you need to focus on all this vegetables and macronutrients, I can say. And we should completely avoid raw seafood and unpasteurized dairy, unboiled milk. You should not definitely have that, because we have more chances of getting this rubella or also mumps infections. So after first trimester, you will be getting this MMR vaccine. Before that, you should keep a very cautious intake of food. Anything which is hot, not hot, you should not take that. So unpasteurized dairy and raw seafoods have to be avoided, and excess of caffeine, alcohol should be avoided at any cost. So these are all the foods we need to focus in the first trimester. So now let's see what is about second trimester. So from weeks 13 to 26, we call it as second trimester. So basically the elongation or the brain and bone development will take place in the second trimester. So rapidly the organs will be growing. That's why we need more calories and calcium and omega 3 rich foods. So in detail, we need at least 1000 mg or 1 gram of calcium every day for bone formation. First calcification or first ossification can be seen in the second trimester. Usually this is the safest period from first and third. So that's why all the nutrients responsible for growth and development we have to give here. And vitamin D, minimum 600 international units of vitamin D, because only if vitamin D, that too along with potassium, is there, the calcium will be absorbed easily into a bone and body, and bone formation will be formed easily happen. And omega 3 fatty acids, this is very very important, because this good fats will not be synthesized in our body. Definitely we need to focus on the outside food sources. In that also DHA, docosahexaenoic acid, and epipentanoic acid we call, these are helpful for formation of brain and eye health of the baby. So if pregnant women is not giving proper omega 3 rich foods, the baby will land up in any kind of abnormal brain development, maybe mentally challenged or autism, ADHD, or delayed speech pattern, or they will be retarded in their growth, or they'll have some blindness, or they will not have proper eye health. So this is very very important phase, I can say. Most of the doctors or healthcare providers will give you calcium and vitamin D supplements, but they are not recommending this omega triples. And especially vegetarian women should take utmost care of having this omega 3, because this is rich in fish. So they won't have fish and they'll end up in this deficiency. So fish or fatty fish foods we can have, and akhrout, walnut, almonds, some seeds like flax seeds, pumpkin seeds, all these are rich in omega 3. So this is very very important for your baby's brain and eye health. Keep it in mind and have this omega 3 rich foods. And iron and vitamin C combination. So iron is very important. In the first trimester we have focused on folic acid. Here iron is very important for formation of new cells, that too immunity cells. And whenever there is an acidic environment, iron absorption will be more. That is the reason always we tell to have along with vitamin C. Even the iron rich, this fish, mutton, or green leafy vegetables, we tell to have along with some lemon, so that the absorption will be very easy. Or you'll get that ferrous citrate, or this combination of iron supplements where you can easily take. Or A supplement is nothing but a medicine which is from the organic sources. So, ferrous sulfate in the elemental form will cause constipation to the pregnant. That is the reason me or many of the nutritionists will be recommending food originated supplements. So, for example, cherry fruits are very rich in vitamin C. Along with that, if iron extracted, so cherry iron supplements, if you are taking, then there will be no chances of constipation and the absorption will be very easy for a pregnant woman. So to prevent any kind of constipation also, we'll be having good amount of fibrous foods, especially this green leafy vegetables, vegetable salads and all, and magnesium rich foods, maybe the lime or pumpkin seeds, and all these seeds are very rich in magnesium. Or you can go, even if it is not sufficient, you can go with organic fiber supplements, so that constipation will not land, and even they can avoid this leg cramps or swelling because of this bloating and constipation. So these are the essential nutrients of the second trimester. So we need to focus mainly on the dairy foods for calcium, nuts for magnesium, and fish for omega 3 foods, and spinach also for iron, and fiber, whole grains, unpolished grains we call it, along with that bran layer. So we need to take that whole grains so that will not land up in constipation. And we have to avoid processed foods, this fast foods. You, yes, you'll have cravings. Usually pregnant women will tell, I have craving for chips, I have cravings for pani puri and all. That will happen only if you are not giving proper protein to your body. So maintain at least 60 grams of protein. You will never land up in cravings, and you can avoid eating this fast food and processed foods and excess amount of salt and sugar, because so much of salt will help, will retain water, and you'll get some leg swellings and cramps, and so much of sugar will spike insulin and glucose levels in your body, and you have risk of gestational diabetes. So the sugar levels or the diabetes which is coming in the pregnancy, we call it as gestational diabetes. So avoid too much of sugar and salt. So now let's see what is actually required in the third trimester, that is from week 27 to 40. So in the third trimester, usually baby will gain weight and the body of the mother will be prepared for labor or delivery. So there is more requirement of energy or calories, and there will be significant increase in the weight of baby, so that digestion, entire body will be focused on baby's growth, so the digestion process will be slowed down. So that's why more chances of constipation also. So the essential nutrients in third trimester are protein. As we discussed, here the baby formation or the abrupt weight gain will happen. So that weight gain is nothing because of muscle growth. So that muscles have to be formed with protein. If mother is not taking proper protein in her food, then the baby will land up in some weak immunity or weak muscles or underweight babies. So you need to take minimum of 70 to 80 grams. In the first trimester, we focused only 50 to 60. Here we are increasing because of the increased demand. So you can take any sources, vegetarians and non-vegetarian sources, but because of constipation, if you are not able to take, you can have some class 1 protein supplements. All the amino acids will be mixed up, and it is very easy for absorption and digestion also. So you can go ahead with plant based class 1 protein supplement along with protein foods to match your requirement, so that baby will grow to the fullest weight. And healthy fats. So we already discussed omega 3 rich foods like fish, oats, and walnuts, that will help in baby's brain and eyes. So don't miss this omega 3 pills. Usually, most of the healthcare providers are not telling this. So if you want, because in the 21st century, many babies are born with this mental challenges or delayed growth. So mother have to take this conscious effort to take this omega 3 rich foods or supplements. And iron and vitamin C. The combination will help in more absorption, and it will be preparing our body for labor, for delivery, because usually there will be some amount of considerable amount of blood loss. So mother will again become so much of weak, anemic, hair fall after delivery, postpartum. They'll gain their weight abruptly, so they should not land up in anemic. So body have to get prepared for this labor, so that more amount of iron and vitamin C and hemoglobin have to be maintained at any cost more than 10 or 12. and 3 plus liters of water per day, and not too much, not too less, I can say. This water intake will flush out all the unnecessary bacterial infections in the UTI. Urinary tract infections will be avoided. And if you are having any kind of swellings in your leg, you can have some seize bath. You can sit in hot water, or you can put your legs in some hot water 10 to 15 minutes along with some salts added. It can reduce the swelling in your body. And calorie rich foods, maybe dates, nuts, seeds, which can ease in more easy labor. Yeah. So foods we have to focus is eggs, lean meats for more protein, and if it is not sufficient, go with safe class 1 digestible plant protein. And more amount of calorie rich foods, also avocados, coconuts and nuts, so that baby will get sufficient amount of omega 3 fats and also this protein and vitamins and minerals for its formation. And avoid spicy foods, fried foods, and too much of caffeine. So in overall, you can see that we have to eat only 3 times a day. Most of the women, pregnant women, they are guided in a wrong way that eat in small quantities, that too in multiple times. No, if eating so many times, that will land you in gestational diabetes. It is very, very difficult. Few will get rid of that easily, but even after few years and months, or after decades also, they are continuing this diabetes and landing up in other metabolic disorders. So eat strictly 3 times a day. And whatever you are getting, maybe some auntie or uncle is giving you so much love in the form of sweets, just preserve that and eat along with your food, so that you will not get any risk of diabetes or high blood pressure also. And balanced amount of carbohydrates, proteins and fats, this is very, very important. Usually an Indian meal will have too much of rice and very less amount of curries or salads. So just avoid in your pregnancy, because your health is very, very important for future baby's health also. So correct 40% of carbohydrates, good amount of 40% of protein, whatever you can have. If usually South Indian breakfast will have something like idli dosa, so try to have some egg dosa, or something like sprouted moong dal dosa, or you can have more amount of vegetables, salads for fiber, so that you can reduce that carbohydrate content. And eat good fat, like avoid completely refined oil, so go for ghee, butter, or any cold pressed oil. That fat is important for your baby's health of brain and eyes. And omega 3 rich foods also, as we discussed. And take prenatal vitamins as prescribed. Don't ignore yours and your baby's health. Maybe iron, omega 3, or calcium, or multivitamins. Take whatever is prescribed. And stay hydrated, minimum 3 liters of water. Of course, you'll have to go for frequent urination, but don't hesitate to drink water. And stay active. It's not like you're pregnant and always you need to take rest. So usually we recommend some 15 to 20 minutes of walking, or some even yoga, prenatal yoga we call it as. So even we in the www calls from Wilson's community, we are also guiding every day morning this 10 to 15 minutes of yoga and some stretches, so you can keep yourself active. And you'll not feel some lethargic or what. And definitely your nutrition plays a very major role in healthy pregnancy, and each trimester requires different specific nutrients and adjustments. It's not like eating same all the months, so change your requirement as per your baby needs. And of course, a balanced diet supports yours and also your baby's health. So I hope I have added some value. And definitely this is not so easy as I tell. So contact your certified nutritionist and get your meal plan or diet tracking ready. So have a safe pregnancy and all the very best.